easy to expel. My concern is that I have been vomiting red blood. Sometimes it is dark brown and resembles coffee grounds in texture. When I vomit blood, I feel the pain and cramps here in the part of my abdomen. I haven't been taking any iron supplements, but I don't know why I have a black tarry stool. Sometimes there is a blood in my stool. Aside from that, I have also been experiencing dizziness or faintness. I have been feeling tired and weak. That's why I always look pale. I also experience pain in my chest and shortness of breath. Here in the part of my abdomen. I haven't been taking any iron supplements.
My name is Evelyn Medina. I am a gastroenterologist. Based on the signs that the patient has been experiencing, the patient shows symptoms of a digestive disorder called gastrointestinal bleeding or simply GI bleeding. GI bleeding is a symptom of disorder in the digestive tract, meaning there's a bleeding in the gastrointestinal tract. The blood often appears in stool or vomit but is not always visible, though it may cause the stool to look black or tarry. The level of bleeding can range from mild to severe and can be life-threatening. GI bleeding can occur either in the upper or the lower gastrointestinal tract. In upper GI bleeding, it can be caused by peptic ulcer, esophagitis, tears in the linings of the esophagus, and abnormal enlarged veins in the esophagus, while lower GI bleeding can be caused by colon polyps, tumors, diverticular disease, hemorrhoids, anal fissures, and inflammatory bowel disease, and proctitis. There are different procedures to diagnose a gastrointestinal bleeding. It can be a blood test, stool test, nasogastric lavage, upper endoscopy, colonoscopy, capsule endoscopy, flexible sigmoidoscopy, balloon-assisted enteroscopy, angiography, and imaging tests such as abdominal CT scan. Often GI bleeding stops on its own. If it doesn't, treatments depends on where the bleeding is from. In many cases, medications or procedure can be given during some tests. For example, it's sometimes possible to treat a bleeding peptic ulcer during an upper endoscopy, or to remove polyps during a colonoscopy. If you have an upper GI bleeding, you might be given an IV drug known as proton pump inhibitor to suppress stomach acid production. Once the source of the bleeding is identified, your doctor will determine whether you need to continue taking the proton pump inhibitor. Depending on the amount of blood lost and whether you continue to bleed, you might require a fluids through a needle and possibly blood transfusion. If you take blood-thinning medications including aspirin and non-steroidal anti-inflammatory medications, you might need to stop. And if you are drinking alcoholic drinks, stop. And if you smoke, quit.
My name is Rojan of Talens. I have been experiencing a persistent abdominal discomfort in this area, and also I often experience cramps in the same spot as well. Sometimes it's severe, and often the pain is mild. I also noticed that I have experienced a persistent change in bowel. In a week, I often experience diarrhea, and several days later, I am constipated. Sudden change in the consistency of the stool also takes place. And also, after taking a poop, I feel that my bowel doesn't empty completely. During the incidents, I'm becoming weak and experiences fatigue as well, which make it more difficult for my condition. I don't have any vices, I don't drink, and I don't smoke as well. I'm not acidic nor diabetic. And these past few weeks, I noticed that I have blood in my stool. That is why I became more cautious and decided to proceed here. During the incidents, I'm becoming weak and experiences fatigue as well, which make it more difficult for my condition.
My name is Cucio, and I am a gastroenterologist. Upon watching and listening to the statement of the patient, I have noticed that he have been experiencing and showing the symptoms of a digestive system disease, which is called the colon cancer. Colon cancer is a type of cancer that begins in the large intestine, also known as colon. Colon cancer occurs when the cells that line the rectum or colon becomes abnormal and grows out of control. The cancer may be caused by genetic mutations, either inherited or acquired. These mutations don't guarantee that the patient would develop colon cancer, but they do increase the chances. Other risk factors might include age, history of polyps, intestinal inflammatory conditions, obesity, diabetes, smoking, and heavy consumption of alcohol. Early diagnosis of colon cancer gives patients the best chance of curing it. Many treatments are available to help control it, including radiation therapy, surgery, and drug treatments that includes chemotherapy, immunotherapy, and targeted therapy. Tests such as fecal testing and blood testing might also be conducted, as well as colonoscopy. I suggest that the patient should urgently seek for help and consult his doctor immediately, because most commonly the symptoms of colon cancer are noticeable in the late stages, which is between stage 3 and stage 4. And in his case, he has already been experiencing different kinds of symptoms. For medications, it is a must for him to consult his doctor first, for them to provide the precise medications that will be suitable for his condition, and to also make sure that the medication that will be provided won't cause any harm.
My name is Bernardo. I have been experiencing a pain, especially in the left side of my lower abdomen. Sometimes, however, there is time that the right side of my abdomen is more painful, and it took about, I think, 1 week, yeah. And I have also experienced vomiting these past few days at the same time as my fever. And recently I have also noticed that even if I eat bunch of foods, eat junk foods, drink soda, experience infrequently bowel movements. But the other day I had diarrhea. Yeah, that's all.
My name is Clarence A. Garcia. I'm a gastroenterologist.
But the other day I had diarrhea.
Based on the incidents that the patient has been experiencing, the patient has been showing the symptoms of a digestive system disease, which is called diverticulitis. Diverticulitis is the infection or inflammation of pouches that can form in your intestines. Diverticulitis happens when the diverticula becomes inflamed and in some cases infected. This can occur when feces or practically digested foods blocks the opening of the diverticula. To diagnose diverticulitis, I will perform a computed tomography scan or a CT scan of your abdomen and pelvis. It is best to perform this scan with intravenous contrast when it's possible. I suggest taking diet modifications, antibiotics, and possibly a surgery. If you're having a mild diverticulitis infection, it may be treated with some bed rest, stool softeners, a liquid diet, antibiotics to fight off the infection, and possibly antispasmodic drugs.
Hi, good evening. My name is Mitzi Angela. I have been experiencing a burning sensation in my stomach for about a week now. And I also experienced vomiting in these past few days. Yes, I can say that I am not acidic and I am conscious on what I eat. Even when I feel hungry, I don't want to eat any food because I feel like I have to vomit it after eating them. And also, it hurts here on the upper part of my stomach. I also wanted to complain that my stomach really hurts bad because I don't eat anything and my stomach is empty. And whenever I feel that I have to vomit, I don't have nothing on my stomach yet, so it hurts like hell. Not to mention, but yeah. My stomach really hurts bad because I don't eat anything.
My name is Keilah Dayrit and I am a gastroenterologist. Based on the incident that the patient have been experiencing, the patient have been showing the signs and symptoms of the digestive system disease called gastritis. Gastritis is an inflammation, irritation, or erosion in the lining of the stomach. Gastritis can be caused by irritation due to excessive alcohol use, chronic vomiting, stress, or certain medications such as aspirin and other anti-inflammatory drugs. It can also be caused by H. pylori, bile reflux, or other infections due to viruses and bacteria. To diagnose gastritis, your doctor will perform a personal and family medical history, physical evaluation, blood tests, fecal occult blood test, are also called stool tests, and also a physical evaluation. I suggest taking antacids or drugs such as proton pump inhibitors, H2 blockers. Avoid spicy foods. Eating healthy is a must. Lastly, consult your doctor.